I usually want to double check Instagram and make sure that we're live on there. How are you doing? How was your Sunday? To all the mothers in the house, I want to say happy Mother's Day. Thank you so much for joining us again for Ask the Doctor. And we truly, truly have a special guest in the house, is an expert, is a senior consultant, and he will be helping us to answer some of your burning questions. But before we go forward, let me just double check that we're live on IG. So that we don't leave our followers on IG hanging. Alrighty. So I think we're live on IG, we're live on YouTube and on Facebook. Thank you all so much for joining us. Alrighty. So we have our guest here today. Let me introduce him. Thank you so much for joining us, sir. We truly, truly appreciate you. Dr. Olaomi Noah is a senior consultant of OBGYN, and he works with the Redeemer Health Center at the Redemption Camp. He is also the MD of Medical Specialist Hospital. He has been full-time practicing for 19 years. So you know that we're not just bringing just anybody on the Ask the Doctor. Is someone that is fully experienced and is an expert in the field. He is very, very passionate, especially about what he does, and especially about helping infertility couple conceive and assisting pregnant women and their babies attain good health through sound health intervention. He is happily married with kids, and he has won a lot of awards. We don't even want to start mentioning them. So I want you to help me to welcome Dr. Noah Ola Omo to the set today. Thank you so much, sir, for joining us. We truly, truly appreciate it. I'm just going to give you some few minutes just to say hello to our audience, our followers, and then we'll start off.
All right, thank you so much. I'm greatly delighted to be with you today. One of the things I have passion for is how to talk to women, both those trying to conceive, those who have children, and be able to address a lot of myths. Because in our society, we are guided by a lot of fake, false beliefs, myths, and this negatively impact on the reproductive outcome for our women. So it's my delight to be with you today, and I hope that my presence will be able to shed light on some nagging issues regarding fertility and other gynecological issues. Thank you
Thank you
so much.
so Thank you so much, sir. Thank you so much. So if you have any question, if you're already live, please share, let them know. Again, we're sorry for starting late. That's due to some mix up in timing and some connection issue. Please help us to share the link. Let everyone know that we're live now and people can please start dropping your question in the comment box and we'll pick it up and read it out to the doctor. But before we start getting the questions come in, I want to ask this question. So we talk about at LifeBloom, we talk about women dealing with reproductive health issues like endometriosis, PCOS, fibroid, and all that stuff. How would you explain the relationship between somebody having endometriosis and then leading to infertility? Because I am an example of that. I had an endometriosis which then led to infertility for me. But in a simple layman term, for our audience to really, really understand, how would you explain?
All right, thank you so much. Now, for us to have a firm understanding and grasp of this, let me just take us to simple biology. The womb of every woman has three parts. The innermost part is what we call endometrium. That is the lining that every month when women menstruate, that's what they shed that come out as blood. We have the muscle and the other part. The way the womb is designed and made, the endometrium should only be inside the womb. Once that endometrium and the tissue is found elsewhere, it becomes endometriosis. And you know that endometrium on a monthly basis, it responds to hormones, estrogens, and progesterone. And it is the hormones that control the endometrium to make you menstruate according to your menstrual cycle. So when you menstruate, the woman bleed and the blood is lost externally. But in endometriosis, this endometrium is found in wrong places. Remember, I've said the endometrium is the innermost part, and the
Yes, sir.
only place it should be ideally is inside the womb. So in endometriosis, this endometrial tissue, by accident or by design, by nature, by some other issue, there are so many reasons by which it happens, is found elsewhere. Some, one of the commonest sites it is found is on the ovary of the woman. It can also be found in on the intestines. It can be found on the fallopian tube. Some it can be found in their chest. So anywhere this tissue is found on a monthly basis, as the woman is menstruating, the woman will be bleeding from there too. Because the tissue endometrium is supposed to bleed once it's exposed to estrogen, the estrogen level reduces. And when women bleed and the bleeding is not being expressed externally, if a woman bleeds, is bleeding inside the womb, those blood will cause some body to react. Just like when you have a scar, you have a wound, the body has a natural way of reacting. So when the body reacts, they form scars. So some of these scars can affect the fallopian tube, causing blockage of the fallopian tubes. Some of these tissue are also not friendly to the egg. Then the tissue, when they some may lead to formation of cysts. We call them endometrial cysts. This can be on the ovary, usually located on the ovaries. What they contain fluid that are bloody, and these fluid they are not friendly to the ovary, they are not friendly to the egg and to the sperm. So in this way, endometriosis contribute to infertility. And very importantly, one cardinal symptom of endometriosis is unbearable menstrual pain. And a lot of these women, they also have pain even when they are not menstruating. And this interferes with their sexual life. To a large extent, that a lot of these women, they run away from sex. And when they don't have regular sexual intercourse, pregnancy also becomes difficult. So these are some of the ways by which endometriosis make infertility a common problem for women that are suffering from them.
All right, thank you so much, sir. Again, to our audience, wherever you're watching from, whether on IG, YouTube, Facebook, drop your comments in the comment section. We have all our LifeBloom team on different platforms. They will pick it and they will send it directly to me so that I can read out the questions. We have one question here. There was a lady that we spoke about. So at Live Bloom we have a community, we have a WhatsApp community where we rub minds together, we share information together, we learn, we pray together, we just educate ourselves together. With It's like a sister circle. And so there was an article that was posted about a lady that does not have that was born without a uterus, and we all know what uterus means to a woman. Now, there's a question here that is there a way around it? Because that means that she doesn't have anything to help her to conceive. Is there a way around it, or she should just forget that she can't get pregnant?
Well, there are ways around that. You know, when babies are born, there are different spectrum of congenital anomalies. What we say that anomaly just means abnormality. Babies born with different challenges. It is possible a lady can be born without the womb. Some babies can be born without even their ovaries. So we need to know, are the ovaries present or absent? Is in this lady, if the ovaries are present and the ovaries are functioning well, it makes a lot easier. She can opt for surrogacy. Another woman will carry a baby for her. It will still be her egg and her partner's sperms. And she will have her babies. Genetically, they will be her babies. If the ovaries are absent, she can adopt. If she has an understanding partner, she can also opt for surrogacy because we can use donor egg and donor sperm. And recently, some women in the developed countries, they are successfully some women have had uterus implants. And they have successfully implanted womb for women
Oh
with
wow.
record of successful delivery after
Mm.
uterus implant. So such a woman, if she can get a very good and appropriate donor, and she has the means, though it's not yet commonly done, but there have been more than one, two successful stories. So that may be at the extreme end, but it's also possible. If she has maybe a sister who has completed her family, the womb is still good, they can transfer the womb to her and she can still carry baby with it. So there are ways out of it, depending on the options.
Oh wow. 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 Interesting. Oh wow. Thank you so much, sir, for answering that question. So another question that we have here is, for someone with endometriosis who wants to get pregnant, what are some important steps they should take while trying to conceive?
Why it is known that endometriosis significantly contribute to infertility, but women still have chance of having their babies. Now, the first one I'm going to highlight is women should not delay getting married. Those who want to have babies, if you have made up your mind that you want to have children, the earlier the better.
Okay.
Some of these gynecological complaints become worse as you grow older. So
Mm,
the first step, I will advise any woman who is really desirous to have babies, as soon as all the factors are okay, financially, psychologically, with your partner, get married and get to business of having babies on time. And once you have been diagnosed with endometriosis, it is very important, see your specialist, the gynecologist on time. There are things we can do to mitigate the impact of the endometriosis. And the outcome is also important on the extent. Though the pain and the symptoms you have, they are not always correlating with the degree of the endometriosis. Some will have very bad and severe endometriosis, their pain will not be so much. For some other people, it may be mild and they'll be having severe pain. So when these are properly treated, they are also dependent on the location. For instance, I've had patients that they have umbilical endometriosis. On a monthly basis, they bleed from their navel. If the only issue they have is just the umbilical endometriosis, and there are no endometriosis involving the reproductive organ, such people may not have issue with infertility per se. But if they have pelvic endometriosis affecting the ovary and all those, infertility become more challenging. IVF readily come to an assisted reproductive technique. It is wise to opt early for those who have endometriosis and they've been married for quite some time. Pregnancy is not forthcoming. Let them go for assisted reproductive technique, in vitro fertilization, donor egg, and all those things to mitigate this problem on time. And there are some that can still conceive naturally when all these other complaints are properly treated. But seeking help on time is very paramount. And I want to advise, especially my Nigerian women, there are a lot of charlatans on social media that will dupe you of your hard-earned money and nothing will happen. They promote herbal remedies,
mm,
they give you false hope, and the most time they don't work. And a lot of women end up wasting their time before seeking for appropriate help. So when you have endometriosis, go for help for gynecological treatment on time. And if the funds are there, go for IVF on time. That gives you better and faster results.
mm. Thank you so much, sir. I know you mentioned that as early as possible, but how long should a woman try when they are dealing with all these reproductive, not only endometriosis, we know there's fibroid, there's PCOS, and all that. How long? 1 year, 2 years before they start seeking help, or once they've tried 1 full year or 6 months, how long should it be?
Now, regarding the time necessary to seek medical help, Like that, for us to get a better grasp of this, let me just explain what we mean by infertility. Infertility is the inability of a couple. And I want my audience to take note of that word couple, not the woman. Because in the African and Nigerian setting, infertility is always blamed on the woman. But it's a lie. I have a lot of clients that the women are perfectly okay, but their male partners have no sperm, some have very low sperm, and other issues. So infertility afflicts the couple and not the woman. After 12 months of having regular, unprotected sexual intercourse. Let's take note of that word regular. It means at least 3 times a week. Because I see couples, they say they are trying to conceive, they meet once a month. I will tell them they are not yet ready because the way it doesn't work that way. The process of procreation is wasteful. A lot of millions of sperm will be wasted in the process of getting a baby. So the coitus sex must be regular, at least 3 times a week, and it must be unprotected. So that won't be like the story of a young lady that the parents had inserted IUCD when you were younger, and she was not aware, and she went about looking for baby
Oh my
after
God.
marriage. So there was no way that woman would have been pregnant for as long as that IUCD was actively working. So all those things must have been there. So if after 1 year of regular unprotected sexual intercourse, there is no conception, it is very important you seek gynecological help on time. Our people will have been married for 5, 6, 7, 8 years, and they are not going anywhere. I have a couple like that, they've been married for almost 8, 9 years. They have not really gone to see for gynecological help. When they came to me, and it was a simple challenge, within a few months of treatment, to God be the glory, they achieved conception and they have suffered for years. But there are also caveats we need to take note. If the woman is marrying at 35 years and above, she should not wait for 1 year. After 6 months, such a couple should seek help. Because the biological clock of a woman is not like that of a man.
Yes.
As you approach 40, menopause is already knocking on the door.
Yes.
The onset of menopause is from 45 years. So when you marry at 35, don't wait for 1 year. After 6 months, even if your husband is 25-year-old, don't wait for 1 year. Come to see your doctor, the gynecologist, to assess you. And the third category, if before you get married, if before you start trying to conceive, you have already known to have a medical condition, you don't need to wait at all. Like I have some ladies who are my
Mm,
clients. They've been coming to gynae clinic for one reason or the other before they marry. Some have PCOS, some have galactoria, milk coming from their breast, and other issues. So I always tell them immediately they get married, they don't belong to the category of those that wait for 1 year because there's already a pre-existing problem. It will not be good care to ask such a couple to wait for 1 year. Some of them, the month they are even getting married, I'm already placing them on medication to use. So there is no one shoe fit all. Your peculiarity will determine what we advise you to do. But it's very important. People should stop delaying. Prayer is very important. I believe in prayer. But do not go about praying for 3 years without seeking medical help. Medical intervention is also from God. And it's
yes.
been giving very good results through God. So those
Yes.
are the categories that we guide our people.
Mm. Thank you, thank you, thank you so much. There's so many questions that I'm trying to, in my brain, trying to drive out from what you have just said. One of it is our men, our male audience, because yes, LifeBloom talk about endometriosis, women related issue, but we also have the men audience because uh, all these issues that we deal with as women, we know that we can't do it alone by ourselves. We have husbands in our lives, we have fathers, we have brothers, so we have men side of our audience. I want you to be, and I think that, I don't know per se, but I think that maybe one of the reasons why men usually don't like to own up that they have fertility issue as well. Number one, maybe ignorance, maybe they don't know. But even to step out and go get the treatment or go talk to someone is quite challenging. Is it that there's no if a man is found having being the one that is having the issue in infertility case, is it that there's no treatment or what, or why is it that our men don't like? Can you please help us address that?
And luckily too, I'm a man, so
Yes, sir,
it's
and yes, you are a man, sir.
a lot easier for me to handle.
For,
You see,
exactly.
African man has ego issues, and fertility issues affect the ego of a man badly. That's just the truth. So
Mm,
once a man feel is the cause of the problem, some men have actually known before getting married, and that's why they'll be bringing up a lot of excuses to avoid going to see the gynecologist.
hmm,
So fertility affects the ego. If the man is the culprit, some men feel less of a man. It makes them feel as if they are not man enough. I know in African society, the society believes the woman is the problem, which is not correct. So the first advice that we have one is that our women too, when it is discovered that your partner is the cause, don't be rubbing salt on the injury. Because when couple have misunderstanding, some women, the first thing that come out of them, they you that you cannot fertilize the egg of a lizard. You are busting the bubble of the ego of that man. And that man may never cooperate with anything again. Because it affects the ego and it makes them feel bad. And some men, even among fellow men, they may be making jest of them when they are moving with men who don't have understanding. But fertility issues arising for men is half treatment. Now, the commonest cause of issue for men is when they have low sperm count. And low sperm count has categories. We have the severe one, the mild, and the moderate. A lot of time, if it is mild, when we talk of sperm count, in those days, we used to use the reference rate of minimum of 20 million per mil of sperm, of semen, 20 to 200 mil, 20 to 200 million of sperm per mil of semen released. But over time, it was discovered that even 15 million is more than enough to impregnate a woman. So this day, before we talk about low sperm count, the count must be less than 15 million. So if a man have less than 15 million, maybe 10 to 15 million, I've had couples that just need to prescribe some medications, not herbal drugs. Because I know in Nigeria there are a lot of herbal drugs claiming also they don't work. From practical experience on the field, I think I've been practicing as a consultant. I've been almost 10 years as a consultant and 20 years now as a doctor. So I've seen quite, by May I will be 20. I've
hmm.
seen quite a lot of issues. But there are other medications we give that work. And I have clients with good results based on that. But if the sperm count is very bad, some have less than 1 million, 2 million, it will be wise to cancel the couple to go for IVF on time so that they don't waste time. But before they go for IVF, we also ask them to do some test like scan of the scrotum to assess their testes, and some may have some condition we call varicose. Some have some kind of water around their testes we call hydrosis. Some of these conditions also contribute to low sperm count. And when they are removed surgically, I've had claimed that their sperm count improved. So men, the issue of sperm count and other issue can also be managed in different ways. So they should own up. They should come up. They should stop holding their partners to ransom. Because in reality, they are holding their partners to ransom. And in Nigeria and Africa, a lot of time, the in-laws will start harassing the women. So there have been some men, I have to tell them, or some women, tell your husband to calm down his family members. Otherwise, you will open up. Because the pressure might be too much on some ladies by the in-laws. Give her children. And the woman is not the one at fault. So at time of counsel the men, talk to your people to leave this woman alone. While you look for a very good and reliable solution to the problem at hand. So men on listening to me should come up. They should open up and let's solve the problem.
Thank you so much, sir. Thank you, sir. I want to um slightly move into fibroid, because I know that fibroid is very, very common, even more common than endometriosis. And I know that I've had different scenarios of fibroid. The first question I want to ask is, I know growing up they used to say that all of us women, we have one amount, or we have fibroid in us. It just depends on how big it is. Can you still hear me?
Hello. Hello, ma.
Okay. Okay, you're back now. So they will say that every woman has fibroid in them. It just depends on how big it is, where it's
Hello.
located. Can you hear me? Can you hear me? Are you still hearing me, sir?
Hello.
Hello, sir. Hello, sir. Can you hear me? This network issue. Can you hear me, sir? Maybe you should rejoin. Okay. I wanted to say you should rejoin. Please bear with us. This is the network issue that we've been facing all day.
Hello.
Hello, sir.
Hello. Sorry, it was my network. Something disrupted my network. So
No problem, sir. So I was just asking about fibroid, you know, and how fibroid, some they will say they have to, before they can start any fertility treatment, they have to take out the fibroid. Some they will leave it and the woman will still get pregnant. I've seen different cases. What is your own advice?
now, relating to fibroid and infertility, it is not a linear equation. For those of us like mathematics, when we say linear, it means 2 plus 2 must always be 4. But in fibroid, it's not like that. And
Okay.
actually, fibroid is not a direct cause of infertility. It is not that once you have fibroid, in fact, majority of women with fibroid have no issue getting pregnant. A common analogy I use for fibroid is like bushy environment and malaria. Over there where you are, the mosquito species that cause malaria is not there. So if the environment is bushy, even if you don't clear it, you won't get malaria. But over there in Nigeria, if your house surrounded by bushes, mosquito will breed and malaria might come. Fibroid is just like that. It's not always that when you have fibroid that you have infertility. It must be causing some other issues to make it to cause infertility. I've had patients that the fibroid by itself is bigger than the baby and the womb and placenta all together, and they still carry the baby to 9 months. So most time, but there are ways by which fibroid can contribute to infertility. If you've been married for years, they've assessed you and your husband, and they could not find any other thing wrong apart from the fibroid, or you want to go for IVF and you have significant fibroid, you may be cancelled at that point to remove the fibroid. Fibroid can also contribute to infertility. One, some fibroid might be located where they are blocking the fallopian tubes. If you look at unfortunately, we can't get a picture of the womb to explain. But in every woman has a pair of fallopian tubes. There's a place where they enter the womb for the sperm and egg to meet. There are some very wicked fibroid that will go and sit down at those points. So they will block the entry where sperm and egg can meet to become a baby. If you remember our basic science, fertilization occurs in the fallopian tube. So if the entry to the fallopian tube is blocked, there will be no fertilization. That's one. Some fibroids too are located in the endometrium that I discussed with earlier. It is in the endometrium that the baby will sit to grow, where we call implantation will occur. Some fibroid could be located there, they will be so big, They will not allow this implantation of the embryo, or some when the embryo have been implanted will be leading to repeated miscarriage. And in some women, fibroid may be so problematic that they will be bleeding almost throughout the month. A woman that bleeds throughout the month will not have time to have sex with her husband. Fibroid can also cause unbearable pain that the woman sex will not be the next thing on her agenda. So these are some scenarios where fibroid can contribute to infertility. But a lot of time we also go after fibroid, not because of fertility issues, but because it's compromising the well-being of the woman. The commonest symptom that fibroid present with is heavy menstrual bleeding and abnormal bleeding. Some women will bleed, they will collapse. Some will bleed, their PCB will drop to as low as 15%, 12%, 17%. At that point in time, pregnancy becomes secondary. It is life. The woman has to be alive first. So there are many reasons we go after fibroid, both for fertility and for other considerations. So if you have fibroid, see your gynecologist who will guide you accordingly, and you'll be guided on the right step to take.
Thank you so much, sir. Before we wrap it up tonight, I have two more questions. One of which I want you spoke earlier on about um egg donor for people that are not able to conceive and all that. And I know that culturally, I'm not sure if we're there yet, if we're beginning to open up to that. Can you please help us to explain to our audience? We don't know who might need it, what exactly you mean by that, and what should be considered, what should be taken into consideration and all that, and just help us explain, because sometimes when people don't know something, um they just immediately say no, they're not doing, but you don't know the benefit, you don't know the pros and cons and everything. So if you could just help us expatiate a little bit on that. Oh my god.
Sorry,
No
I have.
problem, sir.
Okay. So you are talking about egg donation, man.
Yes, sir.
I didn't hear the full question. There was some
No,
interruption.
I was just saying that you mentioned it earlier on as an option for couples that are having infertility issue, but I just wanted you to help us to talk more, like counsel people on what this is, because I know culturally, you know, I'm not sure if we Africans are open to it fully yet, So if we can just talk a little bit on it to let people know, the benefit of it, the idea of it, and what they can expect, what it entails, what they should look out for, is it bad,
All right. I get your question, man. Truly, for a typical African woman, the idea of using another woman's egg is repulsive, is not readily accepted. A lot of them will feel that it's not my baby. I will not be carrying another woman's baby. But legally, biologically, and otherwise, when you consider a donated egg, it's perfectly your baby. We understand the psychological trauma, the feeling, and the depressive symptom that I'm not going to use my egg. But a lot of women have had their fertility challenges resolved through use of donor egg. And it's perfectly legally it's your baby. It's just that a lot of time before women opt for this, we have to do a lot of psychotherapy, counseling for them to let them realize that this option is even better than an adopted child because you are biologically linked. A lot, if especially if the woman carries the baby, you carry the pregnancy for 9 months. People see you because people are bothered and concerned about they won't seeing them being pregnant. People see you are pregnant, you labor, you had a cesarean section, and everybody. So it's your baby by all means, and there's no other parent that they will know with the baby. And ideally, if a donated egg is used, the center conducting the IVF will make sure everything is anonymous. The person donating the egg, yourself will never have any cost to meet, unless you yourself opt to use a family member as a donor, which I strongly advise against. I always advise my client not to use family members to avoid issues later in life.
Yes.
The best is your anonymous egg donors, and there are many young ladies who donate their egg. They will match you for relevant parameters, your blood group, your age. They will screen the donor for other things, and you are perfect. So, and this also brings us to the issue that women should seek help on time. Most time, most ladies that need to use donor egg is because of their age. Most of them. There are younger women who have had issues with their ovaries and may need to use donor egg. But majority are women who are 30 years and above. So that's why I counsel my clients on time that once they have issues, they should go for IVF treatment. They should not wait for so long. I like my religious people. I always tell them that even for IVF to work, you need prayers. So do not look at it as if you are going for IVF procedure, you are no longer having faith. Religion is very strong in our side here. For the
Yes.
IVF to succeed, because the success rate is not 100%, you also need prayer. You need God to make it work. So go for it on time. And the younger the woman, the better. When the woman is young, you a lot of time you won't need the issue of using a donor egg. But when it has come to that point, I want to appeal to my audience that there is nothing wrong with it. The baby is still your child. The baby will has no other mother to call apart from you. And legally and otherwise, the baby is perfectly yours. And it's a very viable option that has helped a lot of infertile couples to overcome their infertility challenge.
All right, sir. Thank you so much. My last question will be on PCOS. We know that PCOS has to do with ovulation, hormone, and all that. And we know how important ovulation is to us women. So, a lady dealing with PCOS and not ovulating regularly, as a married couple, what should they be doing? Is there any lifestyle changes, food, or supplement that they need to be taking, or they just need to go see their OBGYN ASAP?
Yes, PCOS is a relatively common gynecological issue that afflicts
Yes.
our women. And in the street language, the late-term language, it is the one that they most commonly referred to as hormonal imbalance, alongside milk coming from their breast. The hormonal imbalance is a very
Mm,
wide, non-medical term. But you see,
mm,
PCOS itself is an hormonal issue. It's a metabolic issue. When we say metabolic, it has to do with hormones, how they work with how your body works. But it's a condition that can be managed when they seek help on time, both with lifestyle changes and with medications. We observe that quite a lot of women who have PCOS, not all of them, quite a number of them, they have weight challenges. So one of the things we advise that they should lose weight. This can be achieved through exercise, dietary control, and lifestyle changes. And it is important to be proactive about this because PCOS is a known risk factor for developing diabetes later in life. So when it is proactive,
mm.
you lose weight, you adjust your diet. Apart from helping yourself to overcome the fertility challenge, you're also helping your health generally. So some women, when they lose weight significantly, their menstrual cycle automatically improve, even without medication. So another component of PCOS which we advise people about is, just like I said, that the risk of developing diabetes later is there. So there's something we call insulin resistance that is associated with it. Insulin is the hormone that helps us to control blood sugar in the body. So those who have PCOS, a lot of time, we place them on a diabetic medication called metformin. So I'm not advising people on this program to go and be using it on their own without their gynecologic consultation. No. The essence of that is to help to regulate that insulin resistance, which also affects ovulation and fertility. So because, especially in our climate, some people, when they are given that medication, they go to buy at the pharmacy. They will tell them, no, who's giving you this? It is wrong. It's only for diabetes. Have knowledge also kill. It kills a lot of time.
Yes. Yes.
So when you are giving this, and then there are other approaches, the way we manage PCOS depends on if the woman is ready to conceive or she just bothered about her regular menses. If the woman is just bothered about her menstruation, we tackle the issue of insulin resistance and do what we can for the menses to become regular. If it's about fertility, but lifestyle changes applies to all category of PCOS patients. But regarding fertility, if you are ready to consider, other things we do to stimulate your menses, to make you ovulate better, and to conceive. And quite a lot of time we achieve results. But if this fails, they are also a very good candidate to opt for IVF on time. They should not wait for too long. No, they don't ovulate regularly. If they now wait that they are getting to 40 years before opting for assisted reproductive technique, the chance of using donor egg becomes higher in them.
Mm. All righty. Thank you so much, sir. We truly, truly appreciate your wisdom and your expertise in helping us break down some of these burning questions. I truly want to appreciate you for joining us today on Ask the Doctor, and we'll definitely bring you on more time again to help us to break down some of our burning question. And again, to my audience, I want to say thank you so much for hanging in here there with us. We're so sorry for all the network issue. Thank you so much. Please continue to share the link. This is going to be saved on YouTube, on Facebook, on IG. Share it. Doctor has dropped a lot of vital information for women, for men, different options and everything. Please help us share it. You never know who you're helping, you know, and I pray that God will help us in Jesus' name. Thank you so much. We truly appreciate you, sir, for coming again. Thank
Thank you
you.
so
And this is it for us today.
much.
Thank you so much. Bye and God
You are
bless.
welcome.